welcome back to another video. Yes guys, for those who have joined the family for the last few months, welcome. This is your girl Loyal Alice, and I am here to deliver another video for you guys. Yes, it's well overdue and I just get the time, so I'm just gonna go right ahead and get into it. Today's topic we will be discussing is early signs of diabetes. What are we to look out for? Here are some symptoms. So these symptoms are frequent urination, frequent infection, worsening in vision, extreme fatigue, and slow healing. So guys, let's get into this video. What is diabetes? Now guys, if you see me looking down, I have some information here, so I am looking down to share them with you. What is diabetes? Diabetes is glucose or sugar in the blood. This is because your body either cannot produce insulin, and this can be type 1 diabetes, or your body does not use the sugar properly, and this can be type 2 diabetes. Some early signs of diabetes occur in type 1 and in type 1 diabetes, and it tends to cause sudden symptoms, while type 2 diabetes is generally or gradually, but most early signs are the same as both type 1 or type 2, and some tend to be unique as the same type. And these included, as I said early on, frequent urination, frequent infection, sudden worsening vision, extreme fatigue, slow healing, unintended weight loss, extreme thirst or hungry, tingling or numbness in the extremities. So guys, I will explain each topic and tell you how it occurs. So, more frequent urination. This means that your kidney help to process and filter glucose, and with much of it, it's normally being reabsorbed into the body. When the kidney can't keep up with your blood or your glucose level, it gets too high, and this leads to glucose spilling all over into your urine to be excreted from the body, which means that urine more often. So the glucose start filter out in the body, send you to the bathroom to pass your urine consistently. If you see some signs, mostly in children, after you potty train them and they keep wetting their bed at night, this may be their glucose level is too high. Some adults may not notice the increase or the frequent use unless it means that they constantly waking up in the night to go and use the bathroom. Frequent UTIs or yeast infection. This presents glucose in the urinary tract or the genital area. It leads to infection such as urinary tract infection or yeast infection. Poor circulation and weak immune system may also play a role in the increase or the risk of infection. These problems are common in people with diabetes, especially if it's not controlled properly. Infections are common and it more occur in females, but it can occur in anyone. Sudden worsening in vision. High blood glucose level causes the lens in the eye to swell, which changes your vision. It can cause you to have blurry vision and the inability to make out fine details. That means that you can't see the fine print at all because of the high glucose level that gives you blurry vision. Your vision will return normal once the glucose level is in the right range. It will return normal, but if it's still out of the range, then you need to see a medical care. Extreme fatigue are caused by high blood sugar level or high glucose level. And here are some signs that one may experience. Changes in the blood sugar levels, poor sleep frequently, poor nutrition, lack of physical activities, other diabetes symptoms, carrying excessive weight, generally feeling unwell. Anytime fatigue interferes with your daily life, please go and see your medical care doctors or visit a health center and find out what is going on. Slow healing. Slow healing wounds. This included one graze, one cut, one blister, or one bruises. If they are not healed properly, they can get worse and more serious signs of diabetes will be detected. Also, talk to your healthcare provider again. Let them see where they can help you. Poor blood circulation is also a part of feeling fatigue. It slows you down when blood is not circulating properly across the body. Decreased immune system activity or inflammation. So when you're slow healing, when you get a cut, this can be very troublesome. It mostly, if it affects the feet, once the wound is on the feet, this can get worse and it will prompt the doctor to have to amputate your feet if it's not being treated once you detected it. Unintended weight loss. Now, if you ever lose weight without trying and you don't know why, you should go and check that out as soon as possible. Unintended weight loss can be a symptom of several conditions, and it can include in diabetes. It is more common in type 1 diabetes. This can cause by lack of insulin, which prevent glucose from getting stored for energy. When glucose isn't available, the body starts using fat and muscles for energy. And guess what happened next? Extreme thirsty and hungry. So you're feeling hungrier and thirstier than usual, despite eating and drinking more. It can be a sign of having diabetes. Hunger signals comes when the cells that can't remove glucose from your blood and use it properly, so they don't have enough energy to function. They then send a signal to your body to eat more food for boosting your energy. When the blood sugar level or the glucose level is too high, your body tries to dilute it by drawing waters from the tissues. This leaves your tissues dehydrated and causing a thirsty response. So yes, you become very thirsty. You always want something to drink to quench your thirst. If you suddenly have the increase of being thirsty and hungry, and if you can't explain by any other factor, visit your doctor and let them check your sugar level to make them know that diabetes is in the system. Tingling or numbness in the extremities. Tingling and numbness or pain in your hand, fingers, feet, or toes is a sign of nerves damage from diabetes. This symptoms is common in people who have had uncontrollable diabetes for a long period of time. It can also occur in people who are diagnosed with diabetes. Beyond the hand and the feet, in some cases, diabetic nerve damage can cause problems with internal organs or your bladder and heart. Yes, it does. Those organs are affected by diabetes too. So, guys, with all this information that I give you, if you suspect that you have any of these signs and symptoms, please go and visit a healthcare provider or your doctor. Do some tests and let them know what's going on so that they can help you get on track and take care of yourself before things get worse. So guys, it was nice talking to you, nice sharing this with you all. Hope you benefit. Comment down below what you benefit from this little discussion and let me all know what you think. So yes guys, welcome to all those who subscribed to my channel in the last few months. This is your girl Loyal Alice, and I will see you in the next video.